I'm Veronica Martinez, and I'm the Oncology Nurse Navigator for breast cancer patients here at Sarasota Memorial. As a member of the cancer care team, my role is to be like a guide and a support for patients to navigate the healthcare system and make sure that they have access to timely, quality breast cancer treatment. It's sort of like being the team coach for patients and their families, and they are the star team players. When first diagnosed with breast cancer, women are scared, they're worried, they feel overwhelmed. So I usually reach out to every patient with a new diagnosis who's had their breast biopsy done at our breast health center within a week of their results. Often, I'm the one calling to inform patients that they have breast cancer, so I develop a relationship with them from very early on. At that stage, the patient needs a lot of emotional support. Cancer may be the only word they really hear, so I make sure to give them some time to process and take a breath. Sometimes that means just sitting in silence with them for a while. I make sure that before we hang up, that they have my contact information and they understand what the next step will be once they can catch their breath. From then forward, I'll be a point of contact for them, and I maintain frequent communication with those patients, usually until after they've had their initial surgery. I'll then try to see most of those patients in person at the time of surgery or the day after. I also facilitate our monthly woman-to-woman breast cancer support group here. It offers women an opportunity to be with others that share similar experiences so that they feel less alone and more hopeful. Educating patients about breast cancer is an important part of what I do. It empowers them to make informed decisions moving forward. Once the initial shock and fears start to simmer down, patients will start to have questions. How much and what I teach is tailored to each person's needs and unique learning style. Some patients want lots of written materials, for example, while others may prefer to just ask a few questions and need only small amounts of information at a time. The first step for most newly diagnosed breast cancer patients is to meet with a surgeon who will help develop their initial treatment plan. Guiding patients ahead of time on what to expect from that first visit, coaching them with questions they may want to ask or strategies like bringing someone with them, writing down what they're told, and explaining what the usual options that may be presented to them eases a lot of anxiety. I'll follow up with patients after that initial appointment with their surgeon, or patients call me to review what they understood, and I can clarify any lingering questions. If concerns arise, I can also serve as a liaison between the patient and their doctor to ensure that we're all on the same page. During each encounter with a patient, I'm assessing what their cancer diagnosis means in the context of their life. Some patients have a lot of needs, so we try to link them to local and national resources that can ease their journey. There may be financial concerns or lack of transportation, lack of psychosocial supports. For example, I recently had a newly diagnosed patient with some other health issues as well, who had no one to take her home and care for her after her upcoming surgery. This was very distressing to her and a safety concern for me. I was able to share those concerns with her surgeon, and plans were changed so the patient was able to stay in the hospital overnight and receive home health care visits after she was discharged. I also referred the patient to the American Cancer Society, which was able to provide some assistance with transportation and a peer support volunteer to be there when she got home, to call on and check in with her. When I met the patient the day of surgery and again the morning after, she was relaxed and very appreciative of the personalized attention she had received. breast cancer diagnosis can be very overwhelming, but you don't have to face it alone. If you or someone you know has questions or needs support, please contact me at 941-917-3377, or you can email me at veronica-martinez@smh.com.